Hey everybody, Dr. Doug, Bodyworks Physical Therapy. How are you guys doing? Hey, this week we're going to talk about inversion tables. We get a lot of questions about inversion tables and what we think about them, what's our take on them. We actually use them. Been studying this stuff for about 10 years, and we found one from a European country that's top notch, and they figured it out engineering-wise, and we're going to kind of show you how that works. And I got a quote here from my quote wall. One of my patients, she's got hip pain, deep hip pain, and this rolls into traction units or inversion tables. And her quote was, she goes, "Can I get on the Heine transplant list?" Because she has like a persistent headache in her butt. And sometimes if you have a disc problem, it pushes on the nerve root, and all you have to do is just unload that, open up where that nerve root sits, and it takes the pain out of the hip, leg, stuff like that. So let me show you how this whole inversion table works, okay? Okay, we have our lovely assistant here. This is Mike. Mike's a third-year PT student, Wichita State University, go Shockers, who are now changing conferences. Let me show you a couple things here. Hit the button and go horizontal. First of all, we like this one because it clicks in place. Then what he can do is he can go horizontal and he can push. And here's the reason why. They did a research study with, remember those moon boots where they used to hook them in doorways and go upside down? They took their blood pressure, they took their eye pressure, and when they went upside down, their blood pressure just shot through the roof. Their ocular pressure shot right through the roof. And so you don't want to have high blood pressure problems and make it worse, or blow a retina or have eye problems. So people that have blood pressure problems, they can get on this and go horizontal. They can just push and they can get some traction on that back and open it up, okay? Now here's what we like about this, is this whole thing that he's laying on is on rollers, okay? See this? So when he pushes, this whole bed rolls. The other inversion tables, this is just stable, then there's friction between the patient and this, so you have to go down deeper into inversion motion, but then you get more pressure to your head, blood pressure, stuff like that. So click down to the 15-degree mark. So there's 15 degrees, which is really nice, and that unloads lumbar spine, hip arthritis issues, knee arthritis issues, thoracic, cervical issues. I even got one rancher guy who's got a bad shoulder, and he's on this 3 to 8 minutes a day, twice a day. He can now throw his saddle up on his horse where he couldn't before. The inversion table is actually helping his shoulder, which is pretty nice. Okay, go down to 30 degrees. There's the max we go. And we usually say between 3 to 8 minutes, once or twice a day, just to unload the lumbar spine, hips, stuff like that. And for the right people, this is just like golden. So once you come back up to horizontal here. So this is one model. Once you sit up straight, and let's flip over to your stomach. Now here's what they use in Europe. There's been some studies with this in Europe regarding the Swedish national team. Belgium, they use this quite a bit. Norway. And here's what we like about it in our clinic. Let's go forward. There you go. Okay. All right, now what we can do here, got my stomach, he's got a traction thing going on here. Then we can get in here and we can mobilize and manipulate the lumbar spine and thoracic spine while he's distracted. And you don't have to use as much force, and the patient feels so much better. I mean, so much more deeper stretch in that lumbar spine, mid-back, in here. So that's one reason, another reason why we like this table so much. Now let me show you this other home unit.
And Michael is stranded. You're stuck.
I'm going to leave Michael there for a few minutes, okay? He can handle it. Here's a home unit that does the same thing, where you just hook your feet in here, you lay down, inverts 15 degrees, but then there's an exercise program that goes with this. And one of the things we like about this is you can rotate. Put your arm on the floor, and you can open up that whole lumbar spine, hip, SI joint, really good. Just like that. For people like sit in the office all day. And for the right person, it takes the pressure off that nerve root, takes that headache out of their butt and leg. So if you have any back problems, disc problems, osteoarthritis issues, just a stiff lumbar spine, thoracic spine, come over and see us here at Bodyworks Physical Therapy Concussion Center. Let's get you on the inversion table, see if it'll work for you. We'll help you out and get you back to going where you need to go.